Hello and welcome everyone. Today we are going to speak about a very important topic, that is regarding the prevalence, or rather the increasing prevalence of heart disease in the young population. So let's say we are living in a condition where the average working age of our society is ranging between 25 to 45. That is actually the age group where the productivity starts, and beyond 45 to 55 you have a peak productivity level. Beyond 55, obviously the productivity comes down, and society actually depends on this age group of 30 to 55 where the productivity is the most. And hence it goes beyond doubt that if you have to save your society, if you have to have a stable economy, if you have to have a stable system, you have to save this group of people who are in this age segment. But unfortunately, in the current scenario, in the current times, we have multiple examples, starting from the affluent sections of the society, from the TV television stars to multiple gym personalities to multiple other people who have had a sudden cardiac death at ages which are unbelievable. Somebody 39, 42, 53, 48. These are the ages which I have quoted. I'm not saying their names. All of us know their names. A famous singer, famous TV personality. They have all died in that range of 39 to 52. So today we are going to discuss and what is the cause? Why is it happening? Hello and welcome. I am Dr. Debopriyo Mondal, consultant interventional cardiologist, and today I am going to discuss about the major causes of heart disease in the young population. So number one, what I like to point out is the rising incidence and the rising levels of stress, emotional stress, mental stress, which starts very early in the career, and we actually have started this stress amongst ourselves by being competitors. We have all started in this rat race. We are all running into a small tunnel, and all of us actually know that this tunnel has actually got no end. And if you are not able to finish, if you are not able to understand the basic necessities, if you are not able to make out what is expected of you or what are you going to achieve, you are not going to end running. So that is one of the most important driving factors today, that is the mental stress, competitive world, the ability to complete a task, the ability to achieve a goal, the ability to achieve multiple targets, the ability to do something as per your company or as per your senior suggests. That is one of the driving factors today. And this factor is so much so that even young individuals, they're going getting less sleep. A person who's got a EMI till the age of 55 is not going to get a good sleep unless and until he is getting that amount of money. So obviously stress levels are very important. Secondly, the genetic constitution of an individual is very, very important. If your parents are suffering from some heart disease early in their life, let's say in the age of 50 years or 55 years, you also run a very high risk of having a heart disease or maybe a heart attack at a very early age. That is because your genes are responsible. They are not going to give you protection from heart attack. They are going to predispose you towards getting a heart attack. Thirdly, bad lipids. If you have bad LDL, if you have bad triglycerides, if your lipid profile is haywire, you are going to have a very high risk of heart disease. And obviously with this comes the role of sedentary lifestyle, bad food habits, and also the rising incidence of consumption of alcohol and smoking. And it has been seen that smokers actually die very early as compared to non-smokers, and they suffer from multiple cardiovascular as well as other diseases. So what is making them predisposed to all this smoking? So smoking contains TAN, smoking contains other carcinogenic compounds. They actually increase the atherogenicity of your heart, they increase the amount of stress levels, they increase the amount of sympathetic hormones, they decrease your endothelin relaxing factors, and all of them leads to your heart being subjected to lot of stress which it is not accustomed. Therefore, the rising incidence of smoking in the young population, the rising incidence of alcohol consumption, the rising incidence of unhealthy lifestyle, the rising incidence of stress, all of them have become a noose around your neck, around our necks, around the neck of our society, and they are going to constrict if you are not controlling them right now. Therefore, if you want to save the society, if you want to have productive life, you have to curtail all these bad behaviors, and obviously the genetic constitution we cannot change. So we have to take care of that by screening, and by screening you have to get your lipid profile done. You will have to have a checkup if your family members are suffering from heart disease, and that is how you're going to prevent heart disease in the young. So in short, you have to take care of yourself. If you have risk factors like diabetes, hypertension, early onset in your life, you are at high risk. So please screen yourself for cardiac diseases, and please take care of yourself. Please lead a healthy life and take advice from your doctor if you're suffering from any signs and symptoms of heart disease at the earliest. Thank you.